Hi everybody, I'm Dr. Samir Aire. I'm a board certified plastic and cosmetic surgeon. I do practice in Mumbai and Goa, and I'm the director of Evolve Cosmetic Clinic. And today we are going to discuss a very important topic, which is breast implant versus breast lift. Which procedure do you need? So today we'll be discussing the differences between the two, and you will get to know who are the ideal candidates for breast implants, who are the ideal candidates for breast lift. So whatever confusion you had, because in more than 15 years of my cosmetic practice, the patients who wanted something for their breast are very confused whether they are going to need an implant or they should go ahead with a lift. So this video will help you in clear out your confusion, so that at the end of this video you will get a very clear idea whether you should go ahead with an implant or a lift. So basically, what are breast implants? These are the silicone breast implants which we put in your breast. What happens with this kind of implants is this implants gives you a bigger look, a fuller look. It gives you more volume. So it's work on the principle of the balloon, like when you inflate the balloon, how big the balloon becomes. So depending upon that, we can make your breast bigger depending upon what size of implant you choose. So this was regarding why and what does breast implant do. Second comes is breast lift. Breast lift, it's very simple. They are ideally meant to lift your breast. If you're having a saggy breast, if your nipple position is down, then we do lift your breast and take it up, make it more uplifted, more we take it up. Now comes the most important question is, if we are doing a breast lift, sometimes what happens is the breast might become little bit smaller. It becomes usually perkier, but it becomes usually smaller sometimes when we do a breast lift for you. So finally, that brings us to our question: what is the best procedure? Whether you need a breast implant or you need a breast lift surgery. So let me make it little bit more easier for you. We'll go one step back, and that is, if you are looking for fuller breast, bigger breast, then you go ahead with the implant. If you are having sagging, then go ahead with a breast lift surgery. So it's very simple. I like to confuse you and make it more complicated. In that sense, sometimes we do combine breast implant and lift together. When we do it, when patient wants a size increase also, plus to that they want a correction of their sagging breast also. So in these cases we do a breast implant with a lift. So now you are almost completely, you have an idea what implant does, what lift does, and who can go ahead with these procedures. So why this is important? This is important from that sense, because both the procedures are separate, and result wise, your incision wise, your scarring wise, recovery wise, both the procedures are separate. So it's very important for you to understand the difference between the two and choose the right procedure. To elaborate on that, I'll tell you, while doing the breast implant, we do it through a very small incision because we have to put the implant in that. And second thing is that incision is hidden. We put it in the inframammary fold. Sometimes we take a periareolar incision, sometimes we put it through the transaxillary approach. So while doing a breast implant, the incisions are shorter and they are hidden. While in case of breast lift, depending upon what kind of lift we do, the incisions are bigger as compared to implants and they are more visible. So the scarring part is definitely there. For example, if you do a vertical or an inverted T or an anchor kind of breast lift, in which you have a vertical scar as well as you have a horizontal scar, then that is more visible as compared to implant. So what happens when if you do a implant in a patient who needs a lift? So if you're having sagging, your breasts are down, you add more volume, you put an implant in them, then it's very dangerous and disastrous for the patient, because it becomes more sagging. You get a good amount of fuller volume you get, but then with period of time it will become more saggier and it won't look that natural. So that is the reason, if you are having a sagging and if you are looking for some kind of procedure for that and you don't want a scar, then I'll suggest you, frankly, don't go ahead with any kind of procedure rather than going for wrong procedure. So finally, I'd like to tell you when you are going for consultation, just discuss with your surgeon, ask him the options what you are having, and choose it wisely. So if you have liked this video, please subscribe our channel, because we'll be putting more videos regarding breast lift reduction implants on our channel. Thank you so much.